Hold on. Have I started? Oh, I've started. Sorry. Sorry, I was doing something. I've started. Hello, good evening. 7 o'clock-ish. It's Facebook Live and I'm here and you're there. So thank you very much for engaging tonight. We've got some questions already on the old chat, which is always good. Just fiddling with my rubber bands. Olivia's here. Hi, Olivia. Nice to see you. And she's on the home. Oh, she's probably home. And Roseanne's here. And Roseanne's got a question straight in, which is how to do it. That's how you do it, Roseanne. That's how it's done. So if you've got any questions, just chip in like what Roseanne has done. Speak proper like what I do. So it's a bit similar actually to we've got one of my questions here, but anyway, let's get straight in with it. Let's not mess about because we've got a few questions here tonight. So Roseanne saying, how long roughly does the numbness last after a TT? So there is often numbness after a tummy tuck, TT being tummy tuck, and it is often it's quite common to have numbness after a tummy tuck. It is often in the bit of skin between your belly button and the scar. And what I normally say to people is that it's quite common to get it early on and it usually settles. But if it is going to settle, it takes 9 to 12 months for it to settle. So it does take a long time to settle. You know, you're looking at a year for the numbness to settle. Now, it's not normally a big problem. Most people aren't particularly affected by it. They often mention it, but they're not particularly affected by it. And people, as I say, often mention it early on, and then late on, I think two things happen. One, it gets better, and two, you start to sort of get used to it a bit. So I think a combination of the two means that it's not really a long-term problem. But if it is going to get better, it takes 9 to 12 months for it to get better. And the reason you have it is because you do quite a lot of undermining when you do a tummy tuck, and you release a lot of that skin flap in order to bring it down. And sometimes you might interrupt the nerve supply. Sometimes you might be cutting nerves. Sometimes you might just be pushing and pulling with them, and you can't really tell by looking whether because the nerves are just tiny nerves. They're not big nerves. So obviously, if you cut them, it's not going to come back to life. But if you just pushed and pulled them, they will come back to life. But when you push and pull a nerve, when you sort of manipulate a nerve, it takes about a year for it to come back to life. So that's why you don't know whether it's going to come back to life. But don't worry, it will. Hold on a minute. It will be all right. Wait a minute. Olivia's saying she can't hear. Don't do this to me, Olivia. Have I done something wrong? Right. So if you can't hear me, then I'll tell you what I'm going to do. I am going to do that. No. And say, can... Oh, man alive. Right. Let's go old school. I'm going old school. Oh, what's that? Right, have we got audio? Can you hear me? Have we got... Oh, I can hear you. Oh, hold on. People can hear me. Oh, maybe it's just you. It's just you, Olivia. I was about to say that's a relief, but that's bad for you, Olivia. I don't know what's going on then. Oh, that's good. It's not me then. It's not me. Mic number one. 212. Don't have to answer that question again. Can't remember what I said now. Keep my story straight. Oh, is that plugged in all right? Is that... Hello? Right. Okay. So sorry, Olivia. Some people can hear me. So Helen can hear me. Roseanne can hear me. So yeah. So that's the thing about a tummy tuck. You often get numbness and things, but it usually comes back to life, and that runs nicely in with the other question I've got, which I've now. Here we go. Sensation and numbness in brachioplasty. At what point does it return? So similar. Sorry, return straight to. So similar thing. To be honest, the thing that I've just said for tummy tuck is the same for pretty much any operation. It's particularly common with a tummy tuck because you do the undermining. Brachioplasty, you do less undermining, but you are closing under tension, so you are sort of pushing those nerves together. Brachioplasty is slightly different. For those who don't know what a brachioplasty is, it's an arm reduction. Too much skin on the arm, and then you sort of tighten the skin on the arm. Now there is a nerve that runs down the inner aspect of the arm that can be damaged when you do a brachioplasty, and it supplies a patch of skin on your forearm. Which way do I? Sorry, this is all reversed. Patch of skin on your forearm. Patch of skin here. And so sometimes that nerve can get damaged when you do a brachioplasty. So you can sometimes get paresthesia or funny feelings on your forearm, sort of past where the scar is. And it's a similar thing. It might be cut, it might be just bruised. If it's bruised, it takes about a year for it to come back. If it's cut, it doesn't come back, and you always have a bit of numbness or funny feelings on that bit of your forearm. But to be honest with you, it's like the tummy tuck. No one really ever has a big problem with it. It's not a major problem. Those sensory nerves, obviously there's sensory nerves which supply the sensation to the skin, and there's motor nerves which supply movement. Those sensory nerves are often nerves that we'll take if we need to do nerve grafts, if someone has a problem in an important area like their fingers, and we often take one of the nerves from the leg, which supplies a bit of sensation on the outer aspect of the calf. We'll take that nerve and use it to graft into the hand if someone has problems with the sensation in their hand, because sensation in the hand is really important, and people don't really notice a bit of sensory loss in their leg. And similarly in your arm, it's not normally a big a problem. It's something that's good to tell people beforehand so that they don't get annoyed if that happens, and that is a risk with a brachioplasty. You can get paresthesia in that bit of arm, but as I said, it's never normally a big problem. But it does take or it can take a year or so many months for it to come back to life. But after the first few months, everything feels a bit better and you get a bit more used to it, and it's a gradual thing. So it's not suddenly a year it all comes back. It's a gradual thing. It's a gradual thing. Look at that. It is rocking off. I'm losing control here. How long? Oh, I've done that. Have I? Oh, yeah. How long of tummy tuck? Hi, JJ. Hello. I can't hear you. Can everybody else hear? I can hear you. I can hear you fine. X and thanks you. You're very welcome, Roseanne. And then Rosie is in. Can someone with a BMI of 40 have a tummy tuck? So that's an interesting one, Rosie. So the thing about BMI, there's sort of, I would say, I'm going to come out there, Rosie, and I'm going to say 40 is too high, in my view. It's all relative, and there's no law about it. But for me, 40 is too high, Rosie, and I think you have got a very high risk of getting a complication if you have a tummy tuck with a BMI of 40. When we talk about BMI and tummy tuck, the number that most people talk about is 30. And the reason for that is that there has been studies where they looked at BMI of 30 and they say, look, if your BMI is less than 30, you've got less risk of complications than if your BMI is above 30. Having said that, I have done tummy tucks on people who BMI are above 30 because they have lost a lot of weight and they were never going to get to 30. So some people, that is an unrealistic goal. If you have been very overweight, it's an unrealistic goal to get to 30. But I think 40 is too high, personally. But everything's on a case-by-case basis. And I think your chances of wound healing, your chances of complications like DVTs, PEs, chest infections, pneumonias, all sorts of things, it's just going to be higher. And for me, I'm like, I think it probably wouldn't be worth the risk. But what I do, if someone can, I understand that people have often had a massive weight loss and have dropped their, have had a much higher BMI and then dropped it to a low point. So I think it is not unreasonable to do tummy tucks on people who have BMIs higher than 30 on a case-by-case basis. And we would take on board how much weight they've lost, how much weight they want to lose. So certainly if you want to lose more weight, so that's the first thing I'd say to you. Look, are you happy with your BMI? Because you might say, look, I'm not happy, but I find it really hard to exercise and what have you with this apron. And I totally understand that. But I'd say to you, look, you need to get that BMI down to get a better result. I don't know how, and I understand that it is more difficult when you've got the apron. But that the first thing is get it down to where you're comfortable with. The problem comes if you say, look, I'm happy with my BMI 40, I don't want to reduce it, or so you want to get your BMI to where you're happy and you're comfortable. The problems come when people say, well, look, I'm happy and comfortable at this BMI and it's still, over 30. So that's when we have to have a discussion and weigh up the pros and cons. So, I think it's a dubious one, but I'm going to come out there and say 40 is a bit high. But, case by case, I think, you can still do it over 30, but I think 40 is too high. And I think the reason I'm saying that is for your benefit, because you've got a very good risk of a complication, and the complications can be big. A tummy tuck is a big operation and you can have significant complications. So I think that is something to consider. So Olivia says, wait, I can't hear anything. Elaine says, hi. Hi, Elaine. Long time no see. What's up? What are you doing? I'll have to look at your profile. Hope you're doing well. Olivia's going to cry the 1 week I'm here and everything malfunctioning. Okay. Elaine, how often should you have a checkup after having a mole removed? That was malignant. Good one. So it depends, Elaine, on the type of mole. So there are different types of mole. There are different types of malignant moles, I guess. Broadly speaking, there's 3 types, I suppose. There's melanoma, there's BCC and SCC, basal cell carcinoma and squamous cell carcinoma. And we can probably divide it further just into 2 types, melanoma and non-melanoma. Really, there's non-melanoma skin cancer and melanoma skin cancer. Melanoma skin cancer is worse than non-melanoma skin cancer. Melanoma skin cancer is a melanoma is a brown mole that goes bad. A BCC or an SCC is usually a more of a fleshy coloured lesion. They're skin colored, they're red, they're often itchy, they bleed, they don't look like moles so much, and they're less of a worry than a melanoma. So often certainly with a BCC, maybe less so with an SCC, once it's removed, it's cured. So a BCC, basal cell carcinoma, you don't really need any follow-up once it's completely, you send it off histology, check it under microscope, it's completely excised, that's it, you're cured, you don't need any follow-up. An SCC can spread, so as an SCC is a bit more of a worry, so you might, this is all not written in stone and it depends, and there's certainly in the NHS there's guidelines and things, but you might be followed up for a couple of years, 2 or 3 years for an SCC. For a melanoma, so it's melanoma. Okay, right. Okay, good. There you go. She said it's melanoma. For a melanoma, again, it depends on how the thickness of the melanoma. So there's different thicknesses of melanoma depending on how high risk they are. So a thin melanoma is obviously like less than a millimeter thick, will be less of a risk. And there's also melanoma in situ, which is even less of a risk, and then thicker melanomas are actually more of a risk. But broadly speaking, it's the sort of benchmark is like 10 years. 10 years is sort of normal follow-up for a melanoma. I think more and more, particularly in the NHS, they're getting towards doing less follow-ups, because what they've done is they've looked at people who have recurrence, who have something come back with their melanoma, and what you find is actually most of the recurrences are actually picked up by the patient. So actually following people up for many, many years is, you've got to question, certainly when you've got limited resources, is that a good use of resources, when actually if you just educate patients and say to patients, so no matter what type of skin cancer you've had, I would say to you, and even if you don't have skin cancer, look out for lesions, and go and see the doctor if you get a mole or a spot or something changes. That is where probably the most effective way of following up a skin cancer is to educate patients and say to them what to look out for, to tell them what to look out for. And you don't necessarily actually need to monitor even melanoma. You don't necessarily need to follow up patients, as long as they are of sound mind and they are going to come back if they get another spot, or if something comes up, or if something starts bleeding, itching, and they get something, or develop a lump, if they're going to come back. So 10 years is sort of normal for a melanoma, but the most important thing is be vigilant yourself, because most of the things come up with your own, you notice most of the things rather than the doctor. Rosie says she's thinking of getting to 35. I think 35 is a lot more realistic in terms of surgery than 40. I think 35 is still high, and it's a long way to go from 40. So good luck with that, because that'll not be easy. That'll be a challenge, but I think that's a lot more realistic than 40. So 35, I'll be like, oh yeah, maybe we can talk, do a deal. If you can get it down lower, 33, now we're talking. But anyway, good to see you, Elaine. Nice to see you, although I'm not seeing you. But hope you're well, and hope I hope you're all right in terms of the question. Um, so, when can I sleep on my side after brachioplasty? People often ask me when they can sleep on their side, and not even after brachioplasty. Again, brachioplasty is an arm reduction after all sorts of surgery, well, usually breast surgery, because that's probably the most of what I do. Well, if it was up to me, I'd say you can sleep on your side whenever. It's not up to me because you're not my patient. So I would always say talk to your surgeon, and if your surgeon said you shouldn't sleep on your side, which presumably they have, because you're asking the question, when should I sleep on my side? Do what they say. But if it's up to me, I don't tell people not to sleep on their side to start off with. So you could have slept on your side from the start, and I normally say that from my view of sleeping well is more important than worrying about. Well, I don't know what they'd be worried about sleeping on your side with the brachioplasty, but anyway, whatever they're worried about. Yeah. So yeah, talk to your surgeon, but I would I don't tell people not to sleep on their side. Look at that. This is not a ringer. This is a real question, right? I should put this question in every week. Where can I buy your book and how much is it? Well, since you ask, what do you mean this one? I mean this book here, this book that I've written. Yeah. Okay, that's what you mean. You can buy it on Amazon, but it's $12.99, I believe, on Amazon. Yeah, $12.99. It's $12.99 on Amazon, but I give it away because I don't really rely on the proceeds, fortunately, of my book, and I'm not trying to do it for a business and for a venture. So you get it from neveracceptaliftfromstrangers.com. Now, if you get it from there is a postage and packaging. Now, I've been to the clinic. So if you come to the clinic, we give it to you if you come to the clinic. But because I do happy to give it away. But there is a postage and packaging, I think, if you go on the website. But get it from the website and or Amazon, but it's more expensive on Amazon. And so go to the website, I would, or come to the clinic and we'll give you one. Elaine, all right, sorry, thank you. See Olivia's. Thank God she can hear me. Thank God for that, people. iPhone and iPad wouldn't work. Goodness me. So you're on your computer. Stick with the computer, Olivia. I'm not big on the iPhone, iPad, all that stuff. Stick with the computer. I like my laptop, me personally. What we got? We got how soon after surgery, brackets TT, that's tummy tuck, can you have reflexology? I said I didn't know about this. I do know about this because my wife's had reflexology, so I do know what it is. It's the foot thing. It's the foot. They do things to your foot, and it refers to your body. So I am familiar with reflexology. I said I'd Google it, but I didn't have to Google it. So the answer is what I said to the patient was it depends on where they go for the reflexology, because if there's no time that you can have it straight away is the answer. But if you have to drive to the reflexology, maybe 2 or 3 weeks before you be driving. Now, in this situation, the patient has said that the reflexology person comes to their house. So if they come to your house, you can have it straight away. Now, I've got to say, a tummy tuck is a big operation and you will feel knocked back. So you're probably going to feel knocked back for that first week at least. You're going to feel tired, you're going to feel jaded, and I would imagine you wouldn't want visitors at your house for the first week. If you feel that it does you great help, then you can have it in that first week. You'll probably be in bed and a bit bent over. But I would say, give it that first week. You'll probably feel a bit more mobile after the first week and a bit better in yourself. But in terms of the actual doing of it, because it's just, working on your foot, you can have it whenever. Great question, though. Do like that question. What's that, Olivia? Is that a smile? Yeah, I hope it's a smile, not gritted teeth. This is a good one. I like this one. How long should you keep a breast expander in? How long should you keep a breast expander in before exchange? Is there a time scale, and can it cause problems if kept in too long? Thanks. So what this is referring to is a breast expander. A breast expander is an implant that you put into the breast and you blow it up. So it has a reservoir which you can fill with fluid, and it usually has pretty much always has a port And the port is usually a remote port, so it's a little tube and a little button that you can feel under the skin, a bit like a gastric band, that you can put a needle in. It's got a self-sealing valve that you put a needle in and blow it up, or it's got an integral port, which is on the expander where you use a magnet and you locate it and you put a needle in, a similar sort of concept. It's a sort of membrane that you can put a needle in, and when you take the needle out, it seals itself, so you can blow it up. And it's usually used in breast reconstruction. So it's usually used in breast reconstruction because there's a lack of skin, and it's for a delayed breast reconstruction. So someone who's had a mastectomy, who has had the skin all removed and it had the breast removed, and so they've got no breast, and you want to create a breast. And if you want to create it with an implant, what you can do is, obviously you can't put a fully sized implant in underneath the skin because it'd be too tight. So you put an expandable implant in, you put it in flat, you blow it up a little bit, stretch the skin, leave it for a few months, then blow it up a bit more, and you gradually blow it up to stretch the skin. Now, there's two types of expander. There's a tissue expander, and there's an expandable prosthesis. So that's the first question that I'd have. So a tissue expander is literally an empty bag that you blow up. An expandable prosthesis is an implant. It's got silicone shell and a silicone gel like an implant has, but it's got inside, it's got a central reservoir that you can expand to make it bigger. So a tissue expander is always a temporary thing. It's a thing that's just it's an empty bag that's used to stretch the skin. Whereas an expandable prosthesis can be left forever. It can be, you blow it up to the appropriate volume and then you can leave it forever. You don't have to remove it. So that's number one, is an expandable prosthesis or a tissue expander. So let's just assume it's a tissue expander, because if it's expandable prosthesis, as I say, you can leave it forever. If it's a tissue expander, and again, you say you still have these in the breast, you have to leave it for a few months in order to let that skin sort of accommodate to the stretched level, and then you would exchange it for a definitive prosthesis. Now, the question is how long, what was the question? How long should you keep an expander? So I would say 3 months would be normal to leave the expander once it's up to full volume before exchanging it for the definitive implant. Is there a time scale? Can it cause problems if kept in too long? No, it can't cause problems if it's kept in too long. The only problem with it is they're not built to stay in forever. They don't have much shape, and it often doesn't look very good. A tissue expander, they're often quite just sort of round, and they don't look very good. Whereas if you exchange it for an implant, again, if you're doing this for reconstruction, which I'm assuming it's for reconstruction, I could be wrong, but I'm assuming it's for reconstruction. So when we do breast reconstruction, we pretty much always use teardrop shaped implants because they have the shape of a breast, whereas a tissue expander will be just a round thing, which is just generally stretching the skin. So you'd probably want to have it changed because the shape will be better with a definitive implant, and you won't have the port as well. But you don't have to have it changed. There's no problems with keeping it in too long. So in answer to your question, is there a problem leaving it too long? No, there's no problems leaving it in too long. But it's just not designed to stay in for a long time. They're designed just as a temporary skin stretching device. So I wouldn't know why you'd have it in too long, but unless there's a reason, if you got ill or something and couldn't have it changed, then I'm sure that's fine to leave it in a bit longer. Right, we got questions coming in left, right, and centre now, people. This is it's a smile. Nice one, Olivia. Right back at you. Julia, good evening. Hope you're well. Can I ask what is the best way to treat scars after surgery? Query TT. This is to heal and improve the outcome. You know what, Julia? It's funny you should say that because I've just finished this morning. I've finished doing the content for a new page called Scar Removal for the website. I think we've got a scar revision page. Anyway, talking all about how to treat scars. And I've got to say to Julia, plain and simple, I've just done a page on it on the website, which is, written all this stuff. But I'll tell you the abridged version, time. No question. Number one, time. Time is the best thing for scars. Numero uno. I normally let them all heal before doing anything. So personally, I leave things 6 weeks before doing anything. So the first 6 weeks, nothing, nada, niente, just leave it alone. After 6 weeks, you can start doing stuff. Now, stuff means massage usually. Massage and moisturize, because after 6 weeks, often the scar is quite firm, it's quite thick, and quite red. So it's not unusual for it to look quite thickened at the 6 week stage. And it's at that stage we get you moisturizing it. And that is with just whatever moisturizer you've got. If you've got a moisturizer for your body, just use that. Moisturizing it and massaging it. That will help it to soften and settle. Um, if things don't soften, and the majority is that's it. That's it for the majority of scars. Moisturize, massage, and time. People say, what do you massage with? I normally say, look, if you've got a moisturizer, if you've got something you like, just go with that. Some people say vitamin E, aloe vera, um, you know, Nivea, E45, whatever. It just, people say different things. I don't think there's any evidence to say one thing's better than another. If something works well for you, just go with that. So that is the vast majority of scars will heal and will settle with that sort of time. Now, when I say time, I'm talking probably 12 months, really, a year for things to really properly start to settle. So it is a slow process. Now, if things don't settle properly, or if you have problems, or if you have problematic scarring, which is not most people, but some people do have problematic scarring, red scarring, raised scarring. If there's a problem with the scarring, there are things we can do. And probably the main thing is silicone. Now, silicone is marketed as scar management or scar reduction. We sell it at the clinic as scar reduction, and they market it for all scars, but it is quite expensive. And as I say, most scars will settle with massage and moisturizing. Um, but if it is a problem scar, and certainly if it's slightly red and it's slightly raised, then silicone can help. Silicone comes in two forms. It comes in silicone sheets, or it comes in silicone gel. And it depends on the part of the body. For a tummy tuck, then the sheets might be okay because you can hold them in your underwear. Sometimes a bit of pressure can help with the band of the underwear. You have to wear it 23 hours a day. To wear these silicone sheets 23 hours a day. Obviously, take them off to wash, but the rest of the time you should be wearing the sheets. Other parts of the body, like the face and what have you, the gel is good because you can't really walk around with a silicone sheet on your face. And then there are other things we can do to escalate it if things don't settle, things like steroid injections and what have you. But this is more for hypertrophic scars, keloid scars, which is more for certain skin types. Some people are more prone to keloid scars. If there's a problem with the healing, if it takes a long time to heal up, then you maybe get a hypertrophic scar, which will be a red raised scar, which will take longer to settle. So that is the thing for those. So Olivia says scar healing cream Contra Lubex. Olivia, what on this earth is Contra Lubex? I got no idea what Contra Lubex is. Um, Julia says, what about silicone scar sheets? Yes, silicone scar sheets are good, but as I say, they are good for red raised. I'm Googling Contra Lubex as we speak. Contra Lubex. What cream? So yes, silicone sheets are good for raised scars. You can get Oh, is it Contractubex? Is it? Yeah, Contractubex. Blimey, O'Reilly. Here we go. This is good, isn't it? Googling it. Flipping heck. Contractubex. Treating scars successfully. Right. What is it? What is it? Right, find out more. I'm looking at Contractubex now, and is it silicone? To be honest with you, most of them are silicone. I'm assuming it's silicone. Can I just assume it's silicone? And we just assume it's silicone. There's lots of different makes. There's lots of different types, but let's just assume it's silicone. So yeah, the problem is that a lot of these things say they got great scars, and they show a picture of a scar that's been treated with the gel, but scars will settle whatever, So that's the thing. They say, look at this scar now. Look at it 6 months later after we've used Contractubex or Silderm or Kelacoat or whatever. Then it's time that heals most scars. So um, so there you go. Livia got that in India after the eye bag removal. Okay, well, yeah, it looks like it's a silicone type thing. And as I say, and certainly eye bag scars settle so well. Very, very rare to get a bad eye bag scar. So, but yeah, no harm in using them. No harm in using them. They are expensive, the silicone gels, but there's no harm in using them. So it's fine to use it. But I would say, especially something for a tummy tuck, which is a big long scar, I would say, look, moisturizer, massage, and time is where most of the scars healing comes in. The other thing you got to do, look after yourself, eat properly, drink well, avoid the sun, don't smoke. Look after your skin. Oh man, alive, my battery's running out. Can you believe this? Can you believe this? The battery is running out. Okay, so let's do the next question and let's professionally get the battery charger. Okay, is it possible to have implants alone without a lift if you already have 36G chest? Right, this is a funny question, this. Hello? Ready? Right, okay, just looking for some of my family to help me. So it's a funny question because if you've got 36G breast, is it possible to have implants alone? Well, yes, it's possible. Let's stick with we'll stick with it for now, and I'll get the charger if needs be. Yes, it's possible to have implants. And what I normally say is there's shape and there's size, and implants are really good at making the breast bigger. So if you're 36G and you want to be bigger, I mean 36G sounds pretty big to me, then yes, it is possible to have implants, but all they'll do is make your breast bigger. They won't do much to the shape. And often when your breast is a bit bigger, like a 36G, you might have a bit of a droop to your breast. It might be sitting a bit low, might have a bit of a sag to the breast. And implants won't help that. They'll just add volume and your breast will still be saggy and it might not look good. So it's a bit of a, often people say, do I need implants? Do I need a lift? If you're 36G, I'm thinking, what is the problem? If the problem is your breasts are too small, then yes, implants will do the trick, but they won't do much to the shape. If the problem is the shape's not right, if the problem is you say, actually, I don't like the shape, they're droopy, they're saggy, well, then that's not implants you need, that's a lift you need. And if anything, for the 36G, you might want to have a reduction to make them smaller. Because if you have a lift when you're 36G and you've got big breasts, that big breast volume will be acted on by gravity and it can sort of droop again. So that's the opposite of implants. Now we're talking about reductions now, but it all depends on the size. So it depends on the shape. Are you happy with the shape? If you're happy with the shape, fine. And you just want to be bigger, then implants might help that. But the problem is if your breasts are sitting low, you can't put implants too low. So if the implants are sitting up here and your breast sitting down there, you can get an elongated appearance to the breast, so it doesn't look good. So you might need implants and a lift if you want to be bigger and lifted. But it's just a bit of a strange question with the 36G because that that is quite large already. So I hope that's helped that. Oh God, Olivia's gone off on one. Extractum, sepi, and heparin, and so. Right, I need Google Translate for that one. Blimey. Right. Okay. Right. 8 months post-op from man FDL and really unhappy. Not my patient. I should put a disclaimer. Not my patient. It's fine. If you are I'm okay with that. But it's anyway. 8 months post-op from an FDL and really unhappy. My surgeon says he's removed the most he can. I wonder if I could have a tummy tuck as the excess skin is above my scar and under my belly button. I'm gonna wait till my battery goes red. Then I'm going to take action. Tricky, and you know what? I can sort of get an impression what's happened here. The problem with this thing is you've had an FDL, you've had a fleur-de-lis tummy tuck. Now, a fleur-de-lis tummy tuck is an inverted T tummy tuck, viewers. It's a big tummy tuck basically, and it's a normal tummy tuck is just a scar in your bikini line when you just pull the skin down. A fleur-de-lis is when you pull the skin to the side, so you've got an excess not only in an up down direction, you've got an excess in a side to side direction. So you pull it down and you pull it side to side and you get this inverted T-shaped scar. So it's basically a bigger version of a tummy tuck. So people who need a fleur-de-lis tummy tuck are usually people who've had massive weight loss, and people who've had massive weight loss have stretched the skin. And so the skin has been stretched and the skin is often damaged. There's often evidence of that in terms of stretch marks. And so the problem we have is when we do these tummy tucks, with the skin we're leaving behind is damaged skin. The skin that you've left as damaged skin is not as elastic as you would like it to be, because it has been stretched by, in terms of a tummy tuck, is usually pregnancy or weight loss. Those things have stretched the skin and the skin is damaged. So the resulting skin that you're left behind is not as elastic, it's not as tight as we would want it to be. So we've got to get a balance between getting the skin to heal, because that is the big problem with tummy tucks in general, particularly fleur-de-lis tummy tucks. One of the risks is it doesn't heal up properly. A wound breaks down, get wound infections, all sorts of problems like that in terms of a fleur-de-lis tummy tuck. So we don't want that. But at the same time, we want you to be happy, and we want you to feel it's tight as a drum, and we've done a fantastic job, and you've got a washboard stomach. But that's hard when the skin itself has lost its elasticity. So it's always a balance. So you're unhappy because you feel that you've got excess skin. So your surgeon was probably trying to make sure you healed up okay, but now you're like, oh, I've got excess skin. So really, really tough. And I think 8 months post-op, I wouldn't do anything. I think it's way too soon. Could I have a tummy tuck? You've probably not got enough skin for a tummy tuck. Probably. I mean, I've not seen you. I don't know anything about you, but I would imagine you haven't got enough skin for certainly not a full tummy tuck. Could you have a mini tummy tuck? I guess you could, if there's, especially if there's just a bit of skin just above the horizontal scar, just to tighten that bit of skin. If there's above my scar, under my belly button, yeah, maybe a mini tummy tuck just to tighten that bit of skin. I've always said go with your surgeon and work with the surgeon, because they've got a vested interest to try and make things right. So a little revision might be a thing. I don't know. I mean, I haven't seen you, but it could be done. The problem with mini tummy tucks is they do pull the belly button down a bit, because you don't make a scar on the belly button, so it pulls the belly button down a bit. Also, you've got to be a bit careful because you've got that vertical scar, so you've got to, not to put not too much tension on that, because always at the T junction is the worst place in terms of healing. So, got to be careful. I'd probably be waiting at least a year, really, but look at the revision policy of the hospital, because they might say you've got revisions, for a year, and then they don't want to say at 13 months, okay, we'll do a revision, but with, you're going to have to pay for it. Whereas if you'd had it done at 11 months, you wouldn't have to pay. So that's one thing to consider. But tricky one, and I think one of the problems is to realize that it is difficult when your skin has been stretched and damaged to make it really tight as a drum, that maybe that what you would like and what your vision of the result is sounds different to what the surgeon's vision of the result was. Because the way you've worded that, my surgeon says he's removed the most he can, suggests maybe your surgeon's happy with the result, which makes me think, oh, right, or maybe it's your skin that, you just try and make it tight, and you do the surgery and it's tight as a drum when you do the surgery, but then 2 weeks later it's lost that tightness because of the intrinsic elasticity of your skin. Right, what's going on here? What's going on? Lol, that's what it says on the front. Okay, that's right. Okay, is that right? That's the cream, is it? Stuart's in. Is there a limit to how much skin you can take away? Whoa, Stuart, big question there. Whole body removal. No, well, no, Stuart, no, there isn't. First of all, I guess the limit is how much skin is left behind, because you need to, when you cut out skin, you need to close the wound. So there's a limit in terms of that. You can't take out skin and then not be able to close the wound, because then you'd have big open areas and the wound would heal, would open up. So that's the first limit. So you've got to have the excess skin to take. It's got to be excess skin. If you haven't got any excess skin, if you're like, male model, no excess skin, there's a limit to how much skin you can take off that person, because they've, not got any extra. But if you've got excess skin, then you can take off that excess. There's a limit to how much you can take away in one go, because it's big surgery, tummy tucks and things like that. They're big ops. You've got to think about blood loss. You've got to think about healing. You've got to think about pain, discomfort, post-op recovery. So there's limits in terms of how much you can do each time. But if you've got the excess skin, yeah, you can remove it. That is for sure. Becky Eade is in. Nice to see you here tonight, Becky Eade. I hope you're having a good night so far. And Becky says, 2 hours post. 2 hours? What? 2 hours post-op and still swell up to 3 inches and one many meds for nerve damage. Could I have scar tissue? I do need Google Translate tonight. I really do. Now, is that 2 hours post-op? Could that be something else? PO. PO is traditionally post-op or per oral, per oram or whatever, by mouth. We're going to go with 2 hours post-op. So if you're 2 hours post-op, 2 years, 2 years, right? 2 years post-op. She's still swelling up to 3 inches and 1 meds for nerve damage. We got a bit of autocorrect going on here. Probably on meds for nerve damage. Could I have scar tissue? You no, could I, Becky? You will definitely have scar tissue. 2 years post-op and still swelling up to 3 inches. I'm not sure. Does that mean it swells up and down? That if we're talking about tummy tuck, got to wheedle this out. What's going on here? If we talk, it's okay. If it's a tummy tuck we're talking here, Becky? The one thing I'd be thinking: 2 years post-op is a long time to still getting swelling. So I'm thinking: is it intra-abdominal? Are you getting abdominal bloating? Is it a gastrointestinal problem rather than the tummy tuck? You know, you've had a tummy tuck. Well, I'm assuming it's tummy tuck. It might be some other operation, but let's just roll with it. Let's just assume it's a tummy tuck for now. So if it is a tummy tuck, I'm thinking, could there be something else? Because people get abdominal swelling, you know, without having a tummy tuck. So could it be a gastric transit thing? Could it mean, you know, fiber in your diet that you're lacking or something like that, that you need to get your bowel moving better? So you definitely got scar tissue, Becky. Everyone does. Everyone who's had surgery has had scar tissue. So that's normal. So Stuart has lost 11 stone, people. 11 stone in weight. That's crazy. 11. Congratulations, Stuart, is the first thing I'd like to say to you. And I've lots of excess skin to take away, but have already had a huge amount taken away. Yeah, well, this is it. I mean, 11 stone, Stuart, is a ridiculously big amount of tissue. And it's a bit like the lady who was saying she's had a fleur-de-lis and still got excess tissue. I think your skin will have lost its elasticity because it has been stretched so high, so much. And so sometimes you've got to just, you know, get to a place where you're comfortable. You may still have excess skin because your skin has lost its elasticity. And you might just want to say, look, I'm going to quit while I'm here. As long as you're leaving plenty of periods of time and it's safe, you can keep on having bits of skin taken away. But I probably don't need to tell you, Stuart, this surgery is very expensive. Skin, you know, body contouring surgery is big surgery with risks and complications and wound healing, infections and DVTs and all sorts of risks that you can have. So you've got to question whether whether you have it done or not. And it's the law of diminishing returns sometimes. I'm sure the lady earlier who had the fleur-de-lis and said that they've still got excess, I'm sure that she's had a great improvement from that fleur-de-lis. Now, it might not be as much as you wanted to get, but it's a great improvement. So it gets to the law of diminishing returns. Do you want to push it and try and do a bit more for a little bit more? So yeah, it's really, first of all, congrats, Stuart. And I'd get to a comfortable place and maybe think about sort of quitting, because every time you have surgery, you've got risks of complications. Is it worth it? That's my question. Is it worth it? And really only you can answer that. You know, we can tell you what can be done, but only you can answer whether it should be done. Hi, Judith Ombla. Nice. Becky, yes, TT. So it is a TT. Good. Got that right. Nailed it. Years of experience, Becky. Years of experience, yeah. Even when you write in code, I can laser focus through it. I'm always like pregnant. No had gastro checked. Yeah, I mean it depends. So Becky, what I'm thinking is, what the sort of thought process I'd be thinking. 2 years post tummy tuck swelling. I'm thinking, is it, you know, how quickly does the swelling go up and down? You know, because if you get swelling after a tummy tuck, it's usually something like a seroma. It doesn't go up and down that much. It just goes up and then takes ages to go down. If you've got swelling that goes up and down sort of within a day or within a couple of days, I'm like, that's unusual to be soft tissue swelling from a tummy tuck. That's more bowel. That's more like, you know, fiber gel, fiber. Get fiber in your diet and get your castor. You know, it's maybe more bloating rather than the actual tummy tuck. So that's what I'm thinking just from my armchair diagnosis here. But obviously see your doctor. See your doctor. That is the answer. Becky, go and see your doctor. Go and see your surgeon, and then get a proper opinion. Not from this guy on the internet. You know, get it done properly. Thank you for the question, Olivia. Well done, Stuart. Yeah, I second that. Well done, Stuart. Stuart, 11 stones so far. Had arm lift, neck lift, 3 tummy tucks. What? Chest and back lift. Going in 5 weeks to have revision to upper abdomen and been told need a 360-degree lower body lift. Oh my Lord alive, Stuart. Heck, that's hardcore. Don't know what to say to that. You are a walking miracle, and congrats on everything. And go for it if you still got the skin. I'm hoping your weight's stable, because if you like putting on and losing weight, Stuart, you're stretching the skin again. So you're just going to need, that's, when people have a tummy tuck or any of this surgery, if you put on weight again, then you will stretch the skin again. Or if you haven't finished losing weight, then you would be left with redundant skin. That's why you want to wait until you've finished losing weight until you have surgery. Although I can't believe you've got much weight to lose if you lost 11 stone. But anyway, I don't know. But that's congrats on that, Stuart, and good luck with the revision to the upper abdomen. Good luck with that. Olivia, figs, one word. Yep, figs indeed. Becky, after I sit for a long time, after I wake up and work all day, I had a drainless tummy tuck. Well, you know my view on drains, Becky. I do drains, but I can't blame it on the drainless tummy tuck. I do drains personally on a personal basis. I do still use drains for tummy tucks, but it is a bit odd, Becky, for having it after 2 years. Oh, here we go. I did go to my PS. He said nothing can't figure it out. All right. Oh, better than fiber gel. Oh, figs for the gastric transit. Nice one. Thanks, Olivia. Sorry, get it. After I sit for a long time and I wake up. Yeah, I can't particularly figure it out myself either, Becky. It's a tricky one. But yeah, maybe try some figs to see if it's gastric, or see your doctor. Your GP might be able to help if you. Right, what we got? What have we got? We have got. Oh, hold on a minute. Stuart's in. Thank you. Had a gastric bypass 5 years ago. Weight has been stable for 3 years. Well, that's the way to do it, Stuart. Well, that's okay. Well, that goes against the thing that I was saying a minute ago. So yeah, well, go you. Yeah, well, that's good. That's good to hear, because that's not good to have surgery before you have finished your weight loss. Jane Susan, a bit like George Michael. Jane Susan. Jane Susan. I'm considering tummy tuck. Never had surgery. I have a 36 waist and I'm 11 stone 4, 5'1". I hear so many horror stories and I don't know where to go. Jane, you do hear so many horror stories, and if it was me, I think I'd be worried as well, because the stuff I see on the internet is terrible. I think the problem is people just write the bad things. You're probably going to say I'm biased, but honestly, cosmetic surgery has got a low complication rate, despite the fact that the TV is full of terrible results and awful results of surgery and what have you. It has got a low complication rate. Complications are rare, but they do happen, and a tummy tuck is a big operation, so you have to be aware of the pros and the cons. And what I normally say to people is it depends on how much it bothers you. If it doesn't bother you that much and you're frightened of having surgery and you don't want a big scar and you don't want risks of complications, that's fine. Don't have it and just accept that. You say, look, but if you have got a problem, if it is uncomfortable and if it is unsightly, if you don't like it, then it is something that can be done, and it has got a very high patient satisfaction rate. So I would say look at the facts, not the hearsay. And there's an awful lot of hearsay on the internet. And where to go, I would say look for a plastic surgeon, and you can find one with FRCS Plus after their name, PLAST or PLAS sometimes. And also look for someone who is or has been a NHS consultant. You can look on the BARPS, BAAPS or BAPRAS, BAPRAS and BAPRAS websites. I should type that, should I? Anyway, BAPRAS and BARPS, BAAPS. That's got a list of all the plastic surgeons on there. So, here we go. Becky says, find a TT support group. There are a few, and you will see good stuff. There you go. There you go. But this is what we need: the community. The community's helping here, Jane. Look, you got Becky to the Stuart. Oh well, then Stuart had a seroma that infected after the first tummy tuck, but the results outweigh everything. And I've got to say, Stuart would have been a difficult tummy tuck because he'd lost 11 stone in weight. So Stuart was not a straightforward tummy tuck. So I think Stuart would have had a higher risk of complications than someone who had perhaps less of a big operation. I imagine Stuart would have been quite big. But yeah, I think you'll find, Jane, that it has got a very high satisfaction rate. And I am trying to think. I'm trying to think of a single patient who is unhappy that they've had a tummy tuck in my practice. I can't think of someone's going to come on now, aren't they? I can't think of anyone. You do get complications, but usually it's things like wound healing problems, maybe a bit of seroma, but seroma is very rare. At least in my practice, is very rare. I still use drains. Wound healing problem. You do get there is risk of problems. There's no question. I don't want to make out as if you never get a problem, but they're usually manageable, and usually at the end of it, people are usually still happy they've had it done. But you have to go in eyes open, and you have to decide whether it's right for you. But and it is scary, and it doesn't help by the media. The media make out as if all plastic surgery is terrible, but what can you do? That's what the public want to see, I guess. So I'm 8 months pregnant and I've capsular contracture. How soon after the birth of the baby could I have the implants replaced? So I would say don't worry about capsular contracture. Capsular contracture is scar tissue forming around the breast implants, and it happens over time, and it is uncomfortable, and it can make the implants look rounded, and it can be uncomfortable, and it can look unsightly. And you don't have to have anything done about capsular contracture. So it is usually a progressive thing. It usually gets worse, but it takes a long time for it to get worse. It's a slowly progressive thing. So I would say you've got a lot on your plate here with obviously you're 8 months pregnant. Enjoy your pregnancy, enjoy your baby. Do not worry about surgery. You do not have to have surgery. You will not come to any harm by not having surgery. In fact, I would argue the longer you leave it, the better. Always people to say to people who've got capsular contracture, the longer you leave it, the better. Because when you do surgery for capsular contracture, you remove that capsule, you remove the scar tissue, you put a new implant in, but by removing that scar tissue, you create more scar tissue. So another capsule comes quicker. So the longer you leave it before you do surgery for a capsular contracture, the better. So I would say enjoy your baby. And your question is, how soon after the birth of the baby could I have the implants replaced? Now, obviously, you can have a newborn baby, so you're not going to want to go into surgery too soon. I would normally say to people, wait at least 6 months, ideally 12 months. So I would say to you, my advice to you as a friend, not that I know you, but as a fellow human being, is a year. I would wait a year. Let your baby grow up. Let your baby be maybe walking, be a little bit older, be a bit easier to manage. Let your body recover. Let not only your breast but your whole body recover from having a baby. I would say a year is a good time to wait. If you're pushing it and saying, look, this capsular contracture is crippling, it's really uncomfortable, I hate it, I would say probably the soonest would be 6 months. And it depends on how long you breastfeed for. It depends on how well the breasts recover from the breastfeeding and from having the child, because the breasts get swollen and can then change in size and shape. So you probably want things to settle down. Minimum 6 months. Ideally, I would say a year, and the longer you leave it, the better, is my answer to that. What's happening here? I had a seroma. We've done that. Thank you, Becky. Yeah, thank you, Becky. Stuart says you get problems, but it's worth it. Thanks, Stuart, for that. And Stuart, you have been through it. Stuart should know. He's had loads of ops. Olivia, what's written on the door behind you? What's written on the gun? Gun, it looks like. Or guns. This is the gun room. This is where I keep the guns, Olivia. Or maybe I think it's actually snug. Snug from the other side, isn't it? But yeah. Yeah, if you think you're coming to rob the house, we've got guns. No, it's a snug. It's a snug. Jane Susan, I've got diverticular. Would that be an issue? No, Jane, it wouldn't at all. It would only be an issue in terms of bloating and the symptoms you suffer from the diverticular disease. Obviously, you would still suffer after surgery, but it's certainly not a contraindication to having surgery at all. But if you do get bloating or what have you, that might happen after your tummy tuck, but that will be an intra-abdominal bloating rather than the soft tissue. Obviously, the soft tissue would be removed. So yeah, absolutely fine. Last question. And oh my God, I'm on yellow on my, got a yellow triangle, 10% of battery. Olivia's starting with a cold. Right, more of a statement that, Olivia, than a question. But oh, Anne's in. So second to last question, Anne. Big yourself up. I'm gonna need. Do I need to get my charger? I've got less than 10%. Oh man, 9%. Right, hold on a minute. I'm just gonna get one of my team. Guys, ready? Can you just get my battery charger for my computer, please? Plugged in next to the light. Sorry. I'm looking to have a breast reduction. I'm 34 LL at present. Would a 34H be possible? Ready? It's just by the light in here. We'll answer that question. Yeah, just by the light there. Can you unplug it? It's the one nearer the sofa. Right. There you go. That's teamwork. So, Anne. Yes. Now, Anne, definitely yes, that would be possible, and that sounds reasonable to go from a 34 LL to H. Personally, the only thing that worries me a bit about that is you're being a bit specific there. Saying you want a 34H. I don't know about you. There we go. I don't know about you, but after about double D, it gets a bit, well, to be honest, every cup size, it's a bit, I say to people, if they're having implants, even implants where you know what volume implant you're putting in, it's really hard to be specific on cup size. And it's even worse on breast reduction. So you can't really be specific on cup size. So saying that you want to be a 34H, I like the fact that you've kept the number the same. Sometimes people say, I'm a 34 LL and I want to be a 32, H or something. I'm like, the back size should stay the same with the breast reduction. So I like the fact you've done that. And I think an LL to an H is a reasonable thing because how many cups are it? That's and that's probably where you're going to be. That's probably, but if you say to me, look, I've got to be a 34H and I'm not going to be happy unless I'm a 34H, well, I think that's hard because I haven't really got a concept of what a 34H is. So I think what I would say to you, if you are very big, which 34 LL sounds pretty hardcore, you will still be big afterwards. I'll put it like that. You would still be big afterwards because you have to keep enough blood supply and nerve supply going to the nipple. But what cup size you would be personally, and I don't think many people will be able to guarantee you a cup size. And the thing to do is what I normally say to people, I show them before and after photos of some of my cases. And I say, look, this is some before and after photos. You can see they've all been lifted. They've all been reduced in volume. So you can guarantee those two things, reduced in volume and lifted. You can't guarantee the absolute cup size. So you try and keep it in keeping with the frame. You try and bring it back to a more manageable cup size. You try and take the weight off the breast. So there will be significant improvement and significant benefits in doing a breast reduction. But I think just saying, I would say I'd be a bit wary about saying it's going to be an H. But thank you. Good question. Thank you for that. Stuart, chest implants for men, good or bad? Not something I do, Stuart. It's not a thing that I do. So I'm just going to put it like that. People do it. People are happy with it. Therefore, you can't say it's bad. Obviously, men don't have much subcutaneous tissue, so you've got more risk of seeing or feeling the edge. So you're talking about pectoral implants, I think. What you're talking about? They're a bit firmer pectoral implants. I struggle in terms of delivering an aesthetic that I don't. I've got to be understanding what patients want, and this is one of the problems with buttock augmentation. Sometimes I see buttock augmentation and I don't see, I've got to be on the same wavelengths of the patient to give them the result they want. And it's the same with pectoral implants. sometimes see them and think, that's a bit too much and it doesn't look great. And I sometimes see people with gynecomastia who want to have treatment that look like what people who've got PEC implants have got. So when I struggle with that, I think, how can I deliver that result? So therefore, I don't do it. Not therefore, that's not the reason. I don't do it. It's not my niche. It's not my specialty. I do male breast surgery, but it's gynecomastia. I do male breast reduction. I don't do pectoral implants personally, but people do it, and presumably they get good results in happy patients. So therefore, it's good, but they may have unhappy patients as well. I think there are some surgeries that have proven track record. Everybody does it. Loads of satisfied patients. Gynecomastia, breast reduction, tummy tucks. These are real. And then there's some surgeries that are a bit more niche, a bit more on the edges. You're not going to find much about them. Pectoral implants, calf implants, buttock implants. They're all on the edge. They're not that common because it's more difficult to get a good result for whatever reason. Visible scarring, less soft tissue covering. There's various reasons, more complications, implants around muscles, get migration of the implants. So there's more risks and complications. So it's not quite as popular as the others. So the other operations are popular for a reason, and these are less popular for a reason. Jane, thank you, Jane. I'm glad we put your mind at rest. Anne, I don't mind really, but I want to stay in proportion. Yeah, okay. Well, that's exactly what I would want to do, and keep you in proportion and make you smaller. So yeah, well, in that case, yes, Anne, that is possible to achieve that. That is a realistic goal. And I think you've been realistic there, rather than saying I want to go from an LL to a C or a D, because that is not going to happen. Trust me, I'm not scared of a scar. Yeah, well, I bet not, Stuart. You've had an array of procedures. You talking about the implants? It's not so much the scar on the implants, Stuart. It's more the subcutaneous nature of the implant. The implant is quite firm, and I worry about being able to see or feel the edges. But I've got to say, I'm not an expert in pectoral implants, so I don't want to do them down. I think I'll just say that I don't do them, and probably best to see someone who does do them. I don't really know anyone who does do them either, so I don't even know who to recommend you to. Guy Stern maybe does. I'm not sure. Nice guy. Works in Stourbridge, but I'm not sure if he does. Last question. This is the last question now. So if you've got a question out there, viewers, I suggest you get it in. Anne says, thank you. Looks like I better get planning. You get yourself planning and get yourself out there, get planning. So can you explain how breast uplift works? Can you explain how breast uplift works? I have 36G bust and would like a reduction, but worried I'll be quite flat chested without implants. Right. Okay. So what was that? We had one about 36G earlier. What was a 36G? Is it possible to have implants alone without a lift if you're already 36G? Oh, is this the same? Right. Well, this explains the question. This explains it a bit better. So this is a good question, actually. This is a good question. So this makes more sense now. This 36G person who's asking about implants. Right. Okay. So yes, I can explain how an uplift works. So an uplift works by tightening the skin and bringing the nipple from a low position to a high position. If you look at the position of your nipple, if you stand to the side and if you look where your inframammary fold is, your bra, the fold where your bra sits, you project a line forward from that on a lateral view, on a side view. If you project a line forward, the nipple should be about the same level as where your bra wire sits or slightly above it. And people who need a lift, their nipple is lower than that. Their whole breast is lower than that. They have a sag, they have a droop, they have too much skin. And what a lift does is it tightens the skin, brings the nipple up, makes the shape better. It's an integral part of a breast reduction. And although a breast reduction will reduce the volume, whereas a lift won't, that's the difference between the two. But it tightens the skin and makes the shape better. The problem with a lift, and this is something that I always make things clear to people, is what happens, we push the volume all up north, volume stays up high, and then in time that volume settles to what I would call a more natural shape. It's got a more concavity in the upper pole. It's very full in the upper pole, and then it empties slightly to what I would say is a natural shape of a breast. Now, people sometimes say droopy and things. Now, they're not droopy how they were before, but a droop to a breast is a natural shape for a breast. Where implants come in is what you're saying. She's worried. I would like I would like a reduction, but I'm worried I'll be quite flat chested without implants. You're worried that you won't have the sort of roundness and the fullness. Now, you can't get the roundness and fullness, particularly in the upper part of the breast, from the nipple up, without implants. So if you want a rounded look, that is where implants come in. But implants make the breast bigger. Now, some people will do a reduction and then put implants in to give the shape and the fullness. I don't subscribe to that. I've seen good surgeons talking about it, but I don't like it. I don't like the sound of taking out natural breast tissue and then replacing it with an implant. Implants can cause problems in the future. They can go hard. They can get infected. They can cause this ALCL thing that's come out recently. So there's all sorts of issues with implants. So I wouldn't take on implants unless I really had to. And for me, the real benefit of implants is to make the breast bigger. I wouldn't use them just to give you that shape in the upper pole. I would personally, my advice would be say, look, it will be better if you have a lift. Your shape will be better. Your breast will be lifted. Everything will be tightened, and it will be quite full to start with. But then it will settle. And I would say, look, you just have to accept that. And if you want to wear a bra, you can push them up. But out of a bra, they will settle, and that is the shape. And you have to accept that or not, and just say, look, actually, I'm not happy to accept that. And well, then don't have the surgery, because it is quite big surgery with complications and risks. But that is, you have to be realistic about what you can expect from the surgery, and then you can make an informed decision as whether to have the surgery or not. But that is an issue for people who sometimes look at the photos, and I'm very open and make it quite clear with patients having a lift or a reduction, same thing, that the shape is quite full to start with, and then it settles, and it settles to a more natural result, less full in the upper pole. And that's what happens when you're using normal tissues. If you want to have that fuller look, which is slightly less natural, it's not a natural look to have a bump in the upper pole from the nipple up. It's a natural to have it sort of sloping. It's like a slope. It's a concavity in the upper pole is natural. If you don't want that, and certainly if you want a bump and you want fullness in the upper pole, that has to be with implants. But if the size isn't too small, because it's not in your case because you're 36G, I wouldn't think about implants. I would just go with a lift / a reduction. I'd go with a reduction, actually, even better, because then they'll droop less. The bigger they are, the more they droop. So if you make them a bit smaller, they'll droop less, as long as you're happy being a bit smaller. So, yeah, good question. Hope I've done it justice. So, last word to Stuart. Thank you for the advice. Thank you for the input, Stuart. It's nice to have you here tonight, and good luck with everything, Stuart, with your revision and what have you, and well done on your tremendous weight loss. I am going to now declare myself out. I'm going to say to you, put a date in your diary, 7 o'clock Tuesday night next week, here, right now. Get your questions in. You've had some crackers tonight. Thank you for that. And looking forward to more of the same. Tuesday night, Facebook Live with yours truly. Looking forward to see you then. I am going to get some dinner because I'm starving. I had an early lunch. Problem with an early lunch, isn't it? Anyway, see you on the other side, or next week rather.